Turning to COVID-19, South Korea saw more than 200,000 cases of the virus on Monday as the Omicron variant continues to spread throughout the country. Deaths from COVID-19 are also on the rise, with more than 1,000 cases being reported over the past week. Seung-jae tells us more.
South Korea on Monday reported 210,716 COVID-19 cases, along with 139 deaths. It's a 1.5 times increase on the figure reported a week ago and 2.1 times more compared to 2 weeks ago. The big question remains, when will the number of cases in the country peak before we eventually see a downward trend again? Looking at the past week, there's been a continuous rise, figures even surpassing 260,000 last week. On Saturday, the country saw 216 deaths from COVID-19, the highest figure yet. But over the past week, we've been seeing triple-digit figures almost on a daily basis. From February 27th to March 5th, the total number of accumulative deaths from COVID-19 stood at 1,013. If you compare that to the figures from 2 weeks ago, 539 deaths, it's almost double. If you consider the fact that South Korea exceeded 1,000 total deaths from COVID-19 for the entire pandemic in January 2021, 1,000 a week is a very concerning figure. The death toll is mainly occurring among the elderly population over the age of 70, but we are seeing more and more younger people succumbing to the virus. Taking a look at Saturday's numbers specifically, of the 216 deaths, 136 were those over 80, accounting for 63%, followed by 44 in their 70s, 21 in their 60s. But we also saw 9 deaths from those in their 50s, 4 in their 40s, and 1 each in people in their 30s and 20s. Experts forecast that at the very peak, the daily death toll could be 2 to 3 times higher than it is now. The government also announced on Monday that it would increase the number of beds for infected mothers of newborn babies and dialysis patients to 250 and 600 respectively. They also plan to give additional support for childbirth and dialysis hospitals with COVID-19 patients. Meanwhile, starting today, Koreans who have been treated for COVID-19 10 to 40 days before departure will not have to submit a negative PCR test before arrival or even before boarding their plane. Instead, they can submit documentation that shows the date of COVID-19 infection. Prior to this, from last July, the government made it mandatory for all inbound travelers to submit a negative test when entering the country. Seung-jae, Arirang News.